Do you recognize the most common hand syndrome in people doing lots of heavy or repetitive hand activities? Carpal tunnel syndrome, or CTS, is a very common hand and wrist condition which usually leads up to symptoms such as numbness, pain, and tingling in one or both of your hands, wrists, and fingers. This condition occurs when the median nerve, which is responsible for controlling your hands and fingers' movements, is squeezed or compressed as it travels through a narrow tunnel within your wrist named carpal. This disease is seen mostly in people who are doing heavy hand duties or repetitive hand motions for so many years due to work-related instructions. Let's check out top risk factors of CTS. Just remember, anyone can develop carpal tunnel syndrome, especially after being 40 years old, but some people are more likely to get it. 1. Repetitive hand use, repeating the same hand and wrist motions or activities over a prolonged period of time, may aggravate the tendons in your wrist, then causing swelling gradually, which puts pressure on the nerve. Activities such as hammering, using vibrating power tools, or using computer mouses. 2. Hand and wrist improper position, doing activities that involve extreme flexion or extension of the hand and wrist for a prolonged period of time, can increase pressure on the nerve, like too much hand stretching exercises. 3. Heredity, the carpal tunnel space may be naturally smaller in some people, or there may be anatomic differences that will change the amount of space for the nerve in the future. These traits can also run in your family history. 4. Pregnancy, due to hormonal changes during pregnancy, especially multiple ones, the risk of CTS can rise gradually and then show itself when the person gets older. Besides, carpal tunnel syndrome is more common in women. And 5. Chronic health conditions, some conditions such as diabetes, rheumatoid arthritis, underactive thyroid, and obesity can increase the risk and make you vulnerable over time. Your doctor will use a combination of physical and imaging tests to diagnose carpal tunnel syndrome, including Tinel's test. The doctor taps the median nerve at the wrist. A tingling response in one or more fingers indicates damage to the median nerve. Phelan's test, the patient puts the backs of the hands together and bends the wrists for 1 minute. Tingling of the fingers indicates damage to the median nerve. Electromyography, electrodes are placed on the forearm and electrical current is passed through the patient. Measurements on how fast and how well the median nerve transmits messages to muscles indicate if there is damage to this nerve. And finally, medical imaging tests, such as wrist X-rays, ultrasound, and to study soft tissues MRI scan can be really helpful according to your doctor's diagnosis. The symptoms of carpal tunnel syndrome begin gradually in most cases without a specific or visible injury. At first stages you may experience the related signs periodically, but as the condition worsens the symptoms will occur more frequently, or might persist for longer periods of time. The symptoms include 1. Numbness, tingling, burning, and pain throughout your wrist, palm or fingers, especially thumb and ring finger. This one often wakes you up at night. 2. Pain or tingling that may go up the forearm, even extending to the shoulder. 3. Muscles weakness in your hands and fingers that makes it hard for you to lift up or hold typical objects. Even performing fine movements such as buttoning your clothes can be difficult. 4. Dropping things frequently due to weakness, numbness, or a loss of proprioception. Carpal tunnel syndrome treatment divides into surgical and non-surgical methods. At first your doctor may prescribe you non-surgical methods for several weeks up to a couple of months, such as wearing a splint, physical therapy, changing or improving your posture, OTC, and prescription anti-inflammatory drugs, like corticosteroids. But after a while, if the patient doesn't respond to non-surgical methods, or if he suffers severe pain or weakness, surgical procedures will be performed by hand or neurosurgeons to release the median nerve extra pressure. Thanks guys, there are lots of informative medical videos in very simple words on our YouTube channel. Subscribe it to reach latest videos as soon as possible. Take care.